we good to go? Good afternoon. My name is Anna Adway. I am the Public Information Officer for the Cascade City County Health Department. We have come together today to discuss the COVID-19 situation in Cascade County, how it is affecting our healthcare system and our community, and what we can do about it. Our speakers will offer a few minutes each of prepared remarks, and then we'll open it up for a Q&A at the end. Our speakers today are Trista Gardner, the Health Officer for Cascade City County Health Department, Dr. Ray Geyer, the Infectious Disease Specialist from Great Falls Clinic, Dr. Bridget Brennan, the Chief Medical Officer for Benefice, and Kevin Kite, the Director for Emergency Services and Critical Care at Benefice. After that, we'll have Trista Besic, the CEO at Alluvian Health. Then we'll have Col Mark Palmer, the 341st Medical Group Commander. Tom Moore, Superintendent of Great Falls Public Schools. Jane Weber, Cascade County Commissioner. And Mary Moe, Mayor Pro Tem for the City of Great Falls. So without further ado, I'll bring up Trista Gardner, our Health Officer.
Thank you, Anna, and thank you guys all for being here today. I'm just going to give a quick overview of the current state of things in Cascade County in respect to COVID-19, and then I'm going to hand it over to all of those other community leaders that Anna spoke of. To date, we've had 1,308 cases of COVID-19 reported for Cascade County. Over 1,000 of those have been reported in the last 6 weeks, excuse me. We've had 12 COVID-related deaths from Cascade County residents, half of which have been within that same last 6 weeks. We've seen the rate in our county rise from 16 cases per 100,000 people to over 40 cases per 100,000 people in that same time frame. Additionally, we've seen nothing but increases in calls and concerns coming into the health department. So on a daily basis, we're fielding hundreds of calls that are coming in, either people wanting to know what they need to do or reporting some sort of non-compliance out in the community. Things we're hearing pretty regularly are about no mask usage or improper mask usage. At businesses of all kinds, that ranges from your retail to bars to restaurants, every kind of business that you could imagine, we're getting complaints on. And it's not just the patrons entering those businesses, it's also the staff and the employees at those that we're hearing that about. I just want to say masks work when used properly and consistently. We're also hearing a lot of complaints about bars and restaurants operating over capacity, social distancing not happening within establishments. Currently, under phase 2 of the governor's directive, they're supposed to be operating at 75% capacity, and we have reports daily of many places that are not adhering to that. Another big complaint that we're hearing is from employees and people going into businesses. They're being told to come into work when they are sick, when they are supposed to be in isolation or quarantine. We are addressing that and trying to do some public information push in coordination with United Way and Chamber of Commerce, and we'll continue to work on that, working with businesses to educate them about what that means. That if an employee is sick, they need to be out of the workplace. If they're coming in to the workplace while they're sick, instead of having one sick individual, they're going to spread that to the rest of their workforce, and it's going to be a lot more impactful to that place of business. Finally, one of the other things we're hearing is about individuals who aren't following isolation or quarantine orders. Both isolation and quarantine mean that a person should be at home. They should be staying away from household members. not going to work, not going out for social activities, not having visitors over. We do have resources in the community available to help people get groceries or other things they may need when they are in that situation. The other thing that we're hearing about is gatherings happening, and no kind of social distancing or mask usage being used at those gatherings. And that is gatherings, I just want to clarify, of all sizes. Anything from a small 20-person gathering up to a 200-person gathering. There's a local health order in place that does limit those, and we're still seeing those happen outside of that health order. Currently, we do have a lot of cases. One of the questions that keeps coming up is where are those cases originating from? I can say there's a small percentage that are in our schools, but that is a very small percentage. That's not the primary place that we're seeing cases arise from. Our schools are doing everything they can while they're in session and anything that they sponsor to make sure that all of the COVID precautions are being taken. Where we are seeing cases originate from are, like I said, gatherings of all sizes. So whether that's a 20-person birthday party, and we've had a number of those, to a large event, we're seeing a lot of cases come out of those. We are also seeing a lot associated with people going out to bars and restaurants and not following any kind of social distancing or mask usage. We're seeing just general community spread. I think something that's posed to us on a regular is, well, tell me the place of business and I won't go there. Assume it's everywhere. Take the precautions everywhere. This is in our community, so it isn't one place that you need to avoid. You need to think critically about every action that you're taking. And then finally, the other place that we are seeing it is those workplace outbreaks. So somebody that is coming in sick, not taking precautions while at work, and infecting their coworkers. This is not a political or civil rights issue. This is a health and humanitarian issue. This is something that every single individual has the ability to impact. Every business, every person has a responsibility to do everything that they can to prevent the spread of this virus in our community. That's done out of respect for your neighbors, our community businesses, our healthcare workers, and our loved ones. Please take the precautions that you need to make sure that we keep this virus under wraps. And with that, I'm going to hand it over to Dr. Geyer. Thank you.
All right, and next up is Dr. Geyer, an infectious disease specialist at Great Falls Clinic, with a medical update as well as an organizational update.
Thank you. Thanks for having me. And just please tell me if you can't hear me with the mask on. I'm going to do my best. That's on. I don't have to put it on my shirt or anything. Thank you. We're going to hear more from the hospital side here in a few minutes about how we feel our healthcare system locally is being overwhelmed with COVID cases. And so I want to give you a little background to that situation and try to enforce and help understand why we really want to push to the public the infection prevention bundle of mask use, social distancing, frequent hand washing, and frequent cleaning of surfaces. Remember, that's a bundle of efforts. One doesn't work well without the others. So as these cases rise and rise and rise, both locally and in the state, we really need to double down on that message, that prevention bundle of things that we have to do to keep ourselves safe. And I just wanted to introduce that topic a little bit by saying I've interviewed just dozens and dozens of people about their feelings along the way because of how there's been resistance to this message. And, you know, on the one hand, there's people who say, I will absolutely not do those things. Doesn't matter what you try to teach me, I won't do them. But I don't blame or judge, I just wish they made a different decision. And then on the other hand, there's people who have studied this virus and have listened and learned, and without question, they're going to follow these guidelines and try to keep themselves well. But there's a middle group of people that I find, probably more than half the people I talk to, sometimes 2/3 of the people I talk to, that need more information, that need to understand more about the virus, about how to keep themselves well, and they need education to make an informed decision. And that's what I wanted to put together this morning a little bit. There's a lot of people just unsure what to do, and with your help from the media, I think we can try to gather more of those people together so that they feel like they know what to do when they're out in public. So just by the numbers, as of today, the total cases in Montana that started in early March, late February, early March, 21,595 cases. Importantly, 13,212 have recovered, so that's a large number that have recovered. Statewide active cases is 8,148, so those are people still infected who are under surveillance, and we're waiting for them to recover. But probably the most important figure is the deaths, 235 deaths since, let's say, since March 1. That is 5 more in the last 24 hours. And then hospitalizations has gone up by 18 people statewide in the last 24 hours. I think that's really alarming. The death rate is really going up, and the hospitalization rate is going up beyond anything we could have really imagined up to today. So a lot of people, again, they come up to me and say, look at all those people that have recovered. 13,000 odd people have recovered. What do I have to worry about? But we have to focus on the people that have died. And somehow that doesn't get the attention that it should. And yes, the number is smaller than the number of people that have recovered, but it's a deadly virus. And so why are there bad outcomes? That's something I wanted to address this morning. And so what is a bad outcome? It's defined as not being able to weather the virus out at home. You get sick enough that you have to be hospitalized. And then going up the bad ladder, you're in the hospital, you get worse and worse, and you have to go to the intensive care unit. You can't breathe, you have to be intubated and put on a breathing machine, or at the top you die. So that would define a bad outcome. Who is at risk for that bad outcome? That's really important, because these are the people that really have to know that the prevention measures are so critically important for them. And the top risk group, we've had enough time now to learn this. I think when I was in this room in March, who are the risk groups? We thought we knew. Now we really know. And so the top risk group in the United States and in industrialized countries is overweight and obese. Interesting phenomenon. That isn't necessarily true of influenza or other respiratory viruses. So the top risk group is overweight or obese. Those are two different things medically. A personal note, my primary care provider says I'm 20 pounds over my ideal body weight. I'm overweight. So I believe in this stuff. I don't want to be hospitalized or go to the ICU, et cetera, et cetera. I'm in that risk group. And there's a lot of people in America who are overweight and obese. That's the key risk group. And the other key risk group is simply age over 70. As we get older, we predictably do worse with this infection, with SARS-CoV-2 infection, and generally need to get into the hospital. Additional risk groups that predict for a bad outcome are also very common things like high blood pressure and diabetes. Combine high blood pressure, diabetes, overweight, and age over 70, and this is a very bad mix for someone who is at risk for death. Additional medical problems that lead to bad outcomes: chronic kidney disease, liver disease, person having cancer, being on cancer chemotherapy, having a weakened immune system, or under types of medical therapy that weakens the immune system, or HIV infection. There's a collection of illnesses by which you can absolutely predict what's called bad outcome. And for these people, we must have the message that the precautions are essential. They're not questionable. And the precautions, again, at home, out in public, mask use, social distancing, frequent hand washing, frequent cleaning of surfaces. That's called an infection prevention bundle. It works together. One by itself is not as good as all. So then I'll be asked frequently, what about all the other basically healthy folks? They have a perfect body weight like this gentleman. They don't have hypertension. They don't have diabetes. They're absolutely healthy. That's the group largely that has recovered. But, this is a really important point, all of us in healthcare have seen perfectly, during this time that we've been working on this in Montana, for instance, from March 1 to now, we have seen perfectly healthy people do poorly with the infection. And that's a different story. Why is that? And that goes to the concept called immune phenotype, which I'll try to break down for you so that all of us are a little different genetically. Blue hair, blonde eyes. Nope, I'm sorry. Back that up. Blue eyes, blonde hair. So we're all a little different genetically. And we all respond to infections based on our genetics. Not everybody with influenza has an easy course with it. Some get much more ill. So there is a certain immune phenotype genetically, even when you're perfectly healthy, that creates a bad outcome. That gives you an over-aggressive immune response. You not only kill the virus, but you start to hurt your own organs, bone marrow, lung, kidney. So that's an important but. There's a lot of very, very healthy people who get this infection who recover, but some get desperately ill based on this concept called immune phenotype. So the outcome is unpredictable even when you're healthy. There's also some other issues for the young, healthy people that have been devastating strokes, blood clots, and clots to the lung called pulmonary embolism. Though again, even if you're young and healthy, it's not a free ticket to a good outcome. There's also something called post-COVID chronic fatigue, which is really more serious than other forms of chronic fatigue that I've looked at. It goes on for months. We see that in otherwise healthy people. And there's something called cognitive dysfunction, which we know is brain fog, that can happen after this virus, and that goes on for months. So when I talk to people that are otherwise just perfectly healthy, and they say to me, I don't have those other medical risk factors. Why do I have to do these things? These are the reasons. I can't predict that your outcome will be perfectly good. And I've seen some of these devastating strokes in 30-year-olds. We had a child not long ago that had the multi-system inflammatory disorder. So it's unpredictable. So I would promote, again, the same package of prevention measures for people that are young and healthy. The masking, social distancing, frequent hand hygiene, frequent cleaning of surfaces. To that group, the message is protect yourself and protect others. That's all I have for today. Thank you.
Okay, and next up we have Dr. Bridget Brennan from Benefice. She's the medical director, the chief medical officer.
Not sure what I am these days. Hi. I have a very strong sense of deja vu, kind of going back to March 14th when we were all gathered in this room to talk about this pandemic that we had no clue about. I think the weather was actually pretty much the same, shy a couple of inches of snow, which we might get this weekend. I'm going to sound like a broken record because I'm going to say a lot of the same things that you've heard both Tricia and Dr. Geyer say, that you might have heard me say, both in March and yesterday. I'm hoping if we say it enough, people will start to actually hear it. I can't think of another definition aside from public health crisis right now. We have known for a long time that this was coming. We've had the good fortune to be able to look to other parts of the country to see what their experience is. We've known it's going to be here, and for a long time we didn't have any patients, and that has changed drastically. We have more patients than we can handle, and that was my point yesterday. The idea has always been to try to slow this virus down enough so that we can control who gets sick at the same time. Who is going to need a hospital bed? Who is going to need an ICU bed? You hear about all these thousands of patients who are positive, and yes, most do fine. They have a cold or they don't have symptoms at all. But the people that they then expose who do have those chronic illnesses that Dr. Geyer just explained, they are the ones that do require hospital beds, do require an ICU bed. And when you get enough of those all at once, you overwhelm what we have available to take care of you. We have seen over this last 3 or 4 weeks that happen across our state. The native reservations have had huge numbers. It's happened in different parts of the state, and those patients have to go somewhere. The places they usually go are full, which means they come to us. So not only do we have those patients, but we have our patients locally. And so my words yesterday were to plead with people to realize that this is a very, very real situation. It's very real to the people taking care of these patients in the hospital. It's really real to the patients in the hospital, and especially to the family members of those who have died. I can only plead or beg and ask that people be good humans. I mean, that's all I can think of. We know what works. When we were in this situation in March, we were in the middle of a flu epidemic, and the stay-at-home order and people washing their hands and staying away from other people when they were ill stopped it. I'm not trying to wipe this out in one day. I'm just trying to slow it down enough so that we have the chance to take care of people the way we want to take care of them. And so that is my ask. I need you to pay attention to this. It's real. I need you to please wash your hands. Please get your flu shot. Please don't go to work if you're sick, and realize that this is a real situation for a lot of people. I also want to say thank you for the support you guys have shown the healthcare workers in this city. We need it now more than ever. I said that yesterday, and I can only say it again because there are a lot of really hardworking, very dedicated people trying to take care of these patients as best they can. So I will turn it over to my colleague, and thanks for the opportunity. Again, I know I'm sounding like a broken record and you're probably getting tired of seeing me, but I appreciate the time. Thanks.
Okay, next up, and also from Benefice, is Kevin Lynn Kite. He is the Director for Emergency and Critical Care Services.
Hello and good afternoon. I basically wanted to actually speak to how we're doing in the hospitals right now. I can tell you that we at Benefice have been partnering with the hospitals across the state to actually make sure that we know where our capacities are, where our resources are. I can tell you that we've been working also with the North Central region, our hospitals and our critical access hospitals, to help them to make sure that we're taking care of our community, making sure that we're getting people in and taken care of as best we can. Yes, over the last few weeks, we've seen a lot more people show up to the hospital. We've had more admitted to the hospital that are sick. Hospitals across the state are required to have a surge plan, and we have all implemented our surge plans on varying degrees. We have taken care of people that are coming. I will tell you, one of the big asks that I have for the public is, if you're asymptomatic, stay home, seclude yourself somewhere in your house away from your family. Do not come to the doctor's office. Don't go to the urgent cares. Do not go to the emergency departments. If you become sick to the point that you can't take care of yourself, that is when you do access the emergency departments, the walk-ins, the doctor's offices. There is testing available out in the community that we have available in our community, so get that if you feel the need. If you're asymptomatic, please do not go into the healthcare settings. Stay home. Do not go out and visit. Don't go to restaurants. That is a big issue that we're having. The spread of this is really across the whole area and spreading with people gathering, not wearing masks, not washing their hands. Once we get these patients and we test them and they actually are positive and they're sick and they're symptomatic, yes, we're taking care of them in the hospital. We're providing that care. We have had some that have gotten discharged. It's a constant fluid of people coming in. I tell you, there's more people coming in than what are leaving. It is getting bigger and bigger, and it is putting a burden. We're working through it. We're being very conscious of our resources and working throughout the state. That is my biggest plea for everybody, that we're maintaining and we're doing our job, but we're getting stressed and we need some help. And that help is to stay home, wash your hands, wear your mask, and social distance whenever possible. Thank you.
Okay, and next up we have Trista Besic, CEO at Alluvian.
Hi, good afternoon, thank you. As a primary care provider in this community, Alluvian Health's goal as part of this pandemic has really been to assist, benefice Great Falls Clinic, Great Falls Public Schools, our first responders, and provide support services to those entities. Throughout the pandemic, we've provided on-site, remote, and teleservices, and then we also provide some community-based testing services. Our end goal really is to create access to patients in lower acuity settings to decrease the burden on Benefice and Great Falls Clinic's hospitals and ERs. We're designed to help patients that are really experiencing asymptomatic or mildly acute symptoms. Our goal is to help prevent them from showing up in the ER or the hospital in a situation in which they don't need to be there. Those resources are really intended to provide high-level care, and our goal is really to support those agencies and not have them overburdened by patients that don't need to be there. As a collaborative network, we know as healthcare providers, prevention is our best option to ensuring access to care and services for those that are highest at risk or experiencing highest acuity symptoms. Wearing a mask, washing your hands, keeping a safe distance, staying at home if you're sick, and respecting the orders that are being put out by our public health individuals are all essential to protecting those in our community who are at the greatest risk. I think we are tremendously lucky to have as broad and integrated a network as we do that is working together to try and create really collaborative methods of care for our community. It's really up to us as individuals and agencies to be respectful of the protocols that are in place, to really support our staff, to support our community members, that they have the ability to stay home when they need to follow the mandates that are put in place, to understand the education that's out there, and to know when to utilize resources appropriately. If you're a contact or concerned that you might have been exposed, utilize non-contact services. The drive-through screening services are available. Pick up a phone, call a nurse triage line, make a phone call to your primary care provider. Minimize your contact of going into a healthcare setting. If you're experiencing mild symptoms and aren't sure if it's related to COVID, use those resources as well. And if at the point that you do become diagnosed as positive, be respectful of the need to stay home and protect the other individuals in our community. Ensuring access to care for those who are at highest risk and experiencing acute illness starts with prevention. And I truly believe adhering to guidance is necessary to ensure our healthcare network, our first responders, and the medical staff in our community can continue to take care of our community members. Thanks.
Wonderful. Okay, next up we have Col Mark Palmer, 341st Medical Group Commander from Malmstrom. I don't know why I can't say that.
Good afternoon, everyone. On behalf of Colonel Anita Fugate-Opperman, the Wing Commander, I'm Colonel Mark Palmer, the Commander of the 341st Medical Group at Malmstrom Air Force Base. Colonel Fugate-Opperman wanted to be here today, but had some previous commitments, so she couldn't make it. She asked me to share some information on measures we are taking regarding the coronavirus and how that will affect the base and the surrounding communities. First off, she would like to share that while we have been challenged the last 7 months, our readiness and capability to perform our no-fail mission has never been in jeopardy, not even close. We declared a public health emergency on March 13th, and that declaration is still in effect, having been extended a couple of times. Throughout the pandemic, we've analyzed the current and evolving situations and implemented prudent, risk-based measures consistent with guidance from the Department of Defense and the Centers for Disease Control and Prevention that ensure our readiness while still caring for airmen and families. Some of these measures have included mandatory mask wear, use of telework to the maximum extent possible, restrictions of movement both within the country and the state, and closing or modifying operating hours of base facilities. Last week, we changed from Health Protection Condition, or HPCon Bravo, to Bravo Plus. The increased COVID risk to our airmen and families have driven us to implement changes to restrictions such as maximum group size based on our contact tracing findings, as well as some other internal changes to help improve our protection posture. Airmen are still permitted to dine where outdoor facilities are available, and they can utilize restaurant delivery and carry-out services to minimize their exposure to the risk of contracting the illness. But they are not permitted to dine inside restaurants or visit bars and casinos. It has been inconvenient to be sure, but it has been necessary in order to limit transmission of the virus. We are doing everything we can to help minimize the spread of COVID-19. Department of Air Force personnel and their families live, work, and attend school in this community, and we are committed to doing our part to limit the spread of this virus. People who follow the CDC guidance are making a difference in winning countless invisible battles every day. Keeping our base and local communities apprised of changes has been challenging, but we've used a variety of channels, such as Facebook Live, online and social media, mass emails, media releases, and the Air Force Connect mobile application to communicate important data to our audience. As the situation continues to develop, we will continue to hold virtual town halls via Facebook so that you all can hear directly from Colonel Fugate-Opperman and our subject matter experts. We are committed to being transparent and consistent because our members and the community deserve to know the risks and what measures we are taking to protect them. As a partner in the great community, we know the situation affects everyone. We will continue to work closely with our state and regional local health officials to ensure our detection and response efforts are coordinated. Our numbers are reported through the City County Health Department, and we work very closely with them on detection, response, and contact tracing operations. With the help of the public health team, we will continue to assess the risk to the mission and the base population in order to make decisions that balance quality of life opportunities with minimizing health risk to our airmen and families. Tackling this challenge will take a community effort, and Malmstrom, as part of the Great Falls community, is committed to caring not only for our airmen, but also all of our friends, family members, and community members. During a crisis, it is monumentally important to maintain open lines of communication, and we appreciate the spirit of cooperation and collaboration amongst our partners here. We want to continue to earn and maintain your trust and confidence in our ability and intent to be a good partner in this great community. Thank you.
Okay, and next up we have Tom Moore, Superintendent from Great Falls Public Schools.
Good afternoon, everybody. Thank you, Anna. I'm Tom Moore, Superintendent, Great Falls Public Schools. I'd like to first thank all of our healthcare providers that are here today, especially those folks from the City County Health Department and Alluvion for being great partners with the school district in trying to manage and communicate this important situation to our students and our faculty and to our community. I'd also like to thank Benefice in the clinic and our other private health care providers, as well as Malmstrom Air Force Base, for their continued support and partnership in keeping our schools open. And that is our mission, that is our goal, is to keep schools open so that children can be face-to-face with their teachers. We're also providing, as you all know, distance learning and remote learning for those students and families who choose to do that. One of the things that I've been asked to address today is what happens and what is the effect on our organization as COVID positive cases increase. And what happens is it places a tremendous amount of stress on our teachers as students and faculty are isolated or quarantined, because our teachers then have to move to a mode where they are teaching both face-to-face and remotely while individual students are quarantined, or faculty are having to cover for one another if they are being quarantined or isolated. So when the numbers increase, as they have over the last month or so in our community, it puts tremendous stress on all of us, but in particular our teachers, who are trying to do a very good job of educating students in the community. It also places stress on our parents, because if their student is isolated or quarantined, then they have stressors about going to work or not going to work, providing child care, etc. So we know what those economic and family impacts are when we have children quarantined or isolated at home, and so as this community spread increases, it is putting stress on our organization and on our community. Also, the sanitation of our classrooms is something that the district is committed to, adopting protocols to ensure that our facilities are clean and sanitary and disinfected. So if we have a COVID positive case identified, our sanitation team needs to go in overnight and make sure that those classrooms are disinfected with all kinds of measures, including UV lights and so forth, and then be ready to go for the next day. So if we have a number of increased cases in a particular school, it taxes our ability to be able to sanitize those classrooms for the next day. A few weeks ago, we had to close Great Falls High School for 2 days because we had an increased number of COVID positive cases over a weekend, and could not do the contact tracing necessary and the sanitation necessary to reopen that school on Monday morning. So we had to close the school for 2 days. People have asked me, at what point are we going to close schools, or will we close schools? And my answer to that is, in conjunction with advice from all of our healthcare folks, we're going to keep schools open as long as we can, as long as it is safe and manageable to do so. The example that I just gave about closing Great Falls High School was a situation where we could not manage nor provide a safe environment. So that might mean that we will close a school or schools for a period of time until it is safe for students and faculty to return. So I think that kind of hits the effects that COVID have had on us. The current situation in the school district, and I've been trying to communicate numbers out to the community on a daily basis of the active cases since September 30th. We have seen some peaks and some valleys in terms of the COVID positive cases across the school district. Right after the Labor Day weekend, we saw, for those 2 weeks preceding the Labor Day weekend, we saw a huge spike in the number of individuals in the school district that were either COVID positive or were close contacts and needed to be quarantined. The highest number of COVID positive cases we've seen to date in the school district was 29, and I think that was, or excuse me, 31, and that was on October the 2nd. Today, we have 21 active cases, that's students and staff combined. Total cases to date is about 101. Total COVID positive cases of both faculty and students, that's less than 1% of our combined student and faculty population. Currently, we have about 300 individuals that are quarantined. That's about 2.6% of our population. And when students or faculty are quarantined, again, that puts tremendous stress on families, on students, and on faculty. We've seen it affect our extracurricular activities. We've seen it affect the academic learning of our students, most importantly. But it is necessary, again, it's necessary that we follow these strict protocols in quarantining so that we slow and reduce the spread of COVID. And so we didn't make these rules up. We're being asked to follow them consistently and uniformly across the community. And so wearing masks, social distancing, good sanitation practices, staying home if you're sick is vital to slowing the spread. And then making sure that if you were a close contact or you were identified as a COVID positive individual, that you're following the necessary requirements of our health officials and staying home, isolating, and quarantining. I'm extremely concerned about the continued spread, even though, as Ms. Gardner said, we're not linking schools necessarily to this increase. I am concerned about the community spread and how it is going to affect eventually our faculty as well as our students if we have to close schools. So I'm very concerned about that. Again, I appreciate everything that our health community is doing to address this situation, but I ask, and I sent out an email to all of our staff and our students yesterday and posted it on our website. Over this 4-day break, this is teacher convention week, so Thursday, Friday, Saturday, and Sunday, we have 4 days where students and faculty are not in the buildings following our protocols. What they're doing on their own in the evenings and weekends and so forth, I'm hoping and I'm asking them to be smart, to wear masks, to stay isolated as much as possible, follow the protocols that Dr. Geyer, Dr. Brennan, and others have advocated for today, so that on Monday when we come back to school and in the subsequent weeks after this 4-day weekend, we don't see another spike in COVID at our schools. So asking folks to stay home and stay safe. Thank you very much.
Thank you, Tom. Next up, we have Jane Weber, Cascade County Commissioner.
Thank you, Anna. Thank you, everyone, for being here. I just want to open up by echoing Tom's comments that we're in a very fortunate community. You've heard from some incredible professionals in the medical field. They are working together tirelessly so that our community can stay safe. The schools are working 24/7 to keep the kids in the schools so that they can play their sports events, so that they can have activities and have some normalcy in their lives. Our health department is working to advise our businesses to make sure that they conduct their businesses safely. They can answer questions when a business is wondering, what should I be doing to keep the community safe? They're contacting folks who have to be quarantined because they've been in close contact. They've been contacting people who have been tested positive by our providers in the community and Alluvian. And finally, God help us if we get the COVID and we need hospitalization. There are people in our community that are risking their lives to save our lives. So thank you all for that. For those of you who think and have heard that this pandemic is going to be over on November 4th, my answer is that is simply not true. Our professionals have told you what is going on in our community. I've been out of the math class for a long time. So for me, this terminology, exponential growth, was something I needed to look up again so that I understood what it meant. If you're not sure what this means, go to PBS, Google it, PBS exponential. There's a very fine, short clip that tells you what exponential growth is. We're on that trajectory right now. And we can stop that if we work together like this health community is working together for us as community members, by washing our hands, by socially distancing, by being in smaller groups, and yes, by wearing these. So I'm just going to close talking about these. These are a minor inconvenience that can save lives and stop this pandemic from moving forward. So I have two things to ask you to do in our community. Number one, if you're with friends, family, colleagues, or walk into a business and you don't see these properly worn, speak up. Be brave, be polite, but speak up. And the second thing I have to say is walk out. If your friends and family and colleagues don't have enough respect to keep you healthy and them healthy, tell them you want to talk to them virtually. There's other opportunities to connect. You don't need to be together. Take your business elsewhere. There are wonderful businesses in our community that are in full compliance with the mask order. So I'll close by saying, sadly, those two recommendations for me might be the only wake-up call that this community will have that will make them act like a community. Thank you.
Thank you so much, Commissioner Weber. Last up, we have Mary Moe, our Mayor Pro Tem for the City of Great Falls. And after that, we'll open it back up for questions from media and maybe the public.
Thank you.
Most of my job as a city commissioner is listening, so I thought that I'd tell some stories I've heard in the past 2 weeks that put an important face on the numbers you've been hearing. This week I attended a Continuum of Care meeting and listened to all the efforts this group recently made to find a safe harbor for one homeless man diagnosed with COVID. Thanks to the generosity of a local business, they were successful. I heard from the Center for Mental Health about all they've been doing to provide beds and safe supervision for community members whose mental health is suffering as a result of this disease. Last week, I listened as the library board advised their director on how to handle the increasing number of patrons who simply refuse to wear a mask in the library. She has offered to find the materials they want and deliver them to the curb, but they enter and refuse to leave. The board advised her to find a place in the library to sequester them, but they knew it wasn't the perfect solution. It would protect other patients, but not the staff itself. This week, the library had to be closed because staff had been infected. I listened to a school advocacy group discussing the problem that enrollments are down in our public schools. And most distressingly, some 200 children are simply unaccounted for. I listened as a social worker acknowledge that reporting of child abuse and neglect is way down, probably because mandatory reporters like teachers who would normally be noticing children in trauma are simply not seeing them and haven't for months. I went for my own COVID test and watched healthcare workers stand all day in a chilly fairgrounds facility, helping people in car after car get tested. At a teachers' conference, I listened to teachers trying to shore one another up. What they are doing every day goes so far above the call of duty and is so exhausting. I wonder how long they'll be able to shoulder the workload. I listened as a healthcare worker describe the pathos at the nursing home she visited, where the elderly have not had a visit from people they love for 7 months now. They are losing heart, she said through tears. They are losing hope. On a personal level, I listened as a former student in the Flathead County described her stepfather's death. He was hale and hearty and physically active 2 weeks ago. He died a terrible death on a ventilator 6 days after he had been diagnosed. I've learned 2 things from all these stories. First, the victims of COVID go far beyond the numbers who are tested, found positive, get sick, and survive or die. It is a rippling pool of victims with an ever-expanding list of harms that will include all of us if we don't get this virus under control. The second thing I've learned is how many heroes we have among us. I am so grateful to those businesses who find a place for the homeless, defer rent for their unemployed renters, work so hard to keep their stores clean and safe, donate goods and services to those in need. I am so grateful to the teachers, nonprofit workers, government employees, and healthcare professionals who are working with such dedication to do what must be done at considerable risk to themselves. Thank you all. They cannot go on this way indefinitely. They need our help. They need our determined self-discipline. And there is more than one kind of mask that they need us to wear. There is an anger and unrest on all manner of issues right now that is taking a toll on these workers, placing an added burden on them. That anger is particularly harmful to the emotionally fragile, whether they are young or old, impressionable, unstable, anxious, or depressed. Please be careful about that too. Preserve your principles, but please be kind. We all have better angels. We need to summon them now. Thank you.
Thank you, Mary. Okay, so now we're going to open it up for questions from the media, and you can share public's questions if you've got some of those from Facebook Lives. Just say who you want to come up to answer the question. Just try and keep them all together. And yeah, and if you come up to speak, would you please sanitize the podium after you speak? Thank you. First question?
I have a question for Trista Gardner. I heard that the board members with the CCHD are discussing potential future restrictions on Cascade County. What is CCHD considering in deciding what factors, restrictions to put in place?
I think we're considering all kinds of restrictions at this point. We're not looking at a shutdown like we had back in March, but we are looking for different ways to be able to keep this under control and reduce the number of cases that are spreading throughout the community, whether that means shortening hours or capacity or, the number of people at events. All of those are going to be considered and discussed.
And at this time, they're just ideas and nothing is set in stone, correct?
Absolutely.
Can people comment publicly or give suggestions to CCHD about future potential restrictions?
Every board meeting that we have is open to the public, and they are welcome to attend. If they want to submit a comment ahead of time, they can send it to health@cascadecountymt.gov or attend the meeting.
I saw on the Facebook post that CCHD has invited feedback on potential restrictions by email. Is there any general consensus as to what people have been saying in the community?
I've heard things on both ends, that we need far more restrictions, and people with concerns about what that could do to businesses.
And does CCHD have any thoughts on Governor Bullock's plans for more COVID relief funds and educational resources for COVID mandate enforcement?
We very much welcome that and are going to be applying for those funds so we can help beef up our employment and the ability that we have to be going out into the community doing contact tracing and enforcement efforts.
Is CCHD considering possibly pursuing legal action as a possible deterrent against businesses who don't comply with the order?
Under the orders that are in place, that has always been an option. At this point, we have not had to go down that road. If we see continued non-compliance from places, that is an option.
All right. Thank you very much, Richard.
You're welcome.
I have one for you, Tim.
Yeah.
So you're talking about the restrictions, and as we see cases go up and the infection rate go up, is there a point at which we would go into that? Or I guess what are we waiting for with that, with the restrictions? Is there a point you would decide to do it? A number or a rate or something?
I think we're at that point right now, and which is why we're having that discussion and the special Board of Health meeting. We are at the point where we're seeing enough of an increase in this community, the impact to our medical community in particular, our public health, our first responders. we are at a critical point here in Cascade County where we have to look at all options to help curb the spread of this virus.
Thank you. Trisha?
Yes.
You talked about the complaints early on, and you just talked about legal action, but when you're getting those complaints, I know you guys are stretched with contact tracing, so what kind of is your process? Are you to follow up with those businesses, or where are you hearing the complaints?
Thank you, Jen. So, yes, when we receive complaints, and to date we've received thousands, we followed up with well over 200 businesses in our community, and that's telling in and of itself that there's over 200 businesses that have not been complying with orders. We first investigate, that's by calling that business or establishment, talking through them, seeing what they are doing. If we continue to see non-compliance or hear about it, we take it to the next level where we may issue an order of correction. And at that point, if it's still not, we can take it a step further.
Have you, I don't know if you know a number off the top of your head, but issued many orders of correction?
Right now, there's been 3 issued.
I have a question for Dr. Boyer. Goddard, sorry.
Sorry.
Thanks.
So you were talking earlier about the number of recovered cases in the state of Montana. However, a lot of times when people are maybe like hospitalized for coronavirus, they experience a lot of like lung complications. About how many people that are infected with COVID experience long-term health complications as a effect?
I think that's evolving data, but we could separate that out into the folks that needed hospitalization versus those that did not need hospitalization. So the latter group, if you're well enough, that I heard this said nicely by someone else, if you're well enough that you can take care of yourself and you don't need to come into the emergency room or the hospital, what's happening there is either a trajectory of just full recovery. There's about 30% of people who never needed to go into the hospital who are being seen by their physicians for a number of different problems, mainly their fatigue, and from the medical perspective we call it cognitive dysfunction, but we also call it brain fog. Something is not right. They did not return immediately to their previous baseline. How long that lasts is sort of unknown yet. These are people we're going to follow over time, but we should look at that as about 30% of people who are otherwise healthy, who never needed hospitalization. They were either asymptomatic to begin with or had mild symptoms and never needed to come into the hospital. That's one set of data. The other folks that can no longer take care of themselves primarily need to come into the hospital because they come short of breath. That's the leading thing that would say, I cannot stay home, I can't breathe, I've got to get into the hospital. We might add oxygen to them, and that's all they need. And there's also an antiviral medicine that we'll use if someone needs what's called supplemental oxygen, called remdesivir. Generally, those folks also, if they never need the next steps, they never need intensive care or ventilator, they will recover, but we're also seeing the same fatigue syndrome in them. And then the others that survive an ICU stay or survive a ventilator stay appear to have much longer recovery times. Whether they have permanent lung injury is unknown. It's probably just not been around enough, 6-7 months of disease. We need more time to really figure out the length of time that some of the sicker people might experience long-term symptoms, but we're definitely seeing it. If you survive a ventilator stay, what's called respiratory failure from SARS-CoV-2, if we were to think of a number, I'm seeing about 80% of people have some prolonged respiratory complaint, and maybe only 1 out of 5 goes back to the previous baseline with no problems. if that helps. It's a moving target as we get more data. But
Yeah, absolutely. Thank you.
clearly having the infection is not a guarantee that you will just have a perfectly normal outcome. Yeah.
Thank you.
Thank you.
Another question for Dr. Brennan.
Yes, sir.
Doctor, if a nurse or any employee of benefits comes into contact with somebody who's tested positive, or potentially does, and they require to quarantine 14 days as a normal person,
Is an employee who comes into contact with a positive patient?
benefits worker, yes.
So you're asking about direct exposures? Is that what you're asking about? So I would think that almost anybody in this area, and including in this room, would be a potential exposure. If we considered potential exposures as something that mandates a 14-day quarantine, we would not have a hospital or a staff to run the hospital. We have policies in place at the hospital and in our clinics that mandate masking while you're at work. We've put restrictions into breaks and meal times so that people aren't sitting closely and sharing, a meal and potentially exposing one another. If you're symptomatic, you're not working. If you are positive, you're not working. If you have a potential exposure, there's a good chance we're going to have you work as long as you don't develop symptoms. And so we ask that you monitor that closely. You check your temperature. If you do become symptomatic, we're going to test you. And, we try to do things based on both what the CDC is recommending and on a case-to-case basis. If you are in a position where you can go home for 14 days, that's great. We don't have a lot of those people. We need people to work. And so we're trying our best to keep everybody as safe while they're at work so they're not exposed. And we have to rely on people to follow those policies.
Are you asking employees to get tested here and there only if they show symptoms?
We're testing our symptomatic employees. If you feel like you want to be tested, you certainly have those venues. We have our friends at Alluvian who are helping. There's multiple places people can go to get tested.
Thank you.
Did that answer your question?
Yes.
Okay. Anything else while I'm up here?
Yeah, while you're up there, for the people sort of along those lines caring for COVID positive patients, are there any additional protocols for them or testing? They are obviously exposed.
I'm sorry, I didn't hear the first part of your question.
Oh, sorry. For the healthcare people taking care of the COVID patients,
Yep.
are there any different protocols for them since they're obviously being exposed?
The people taking care of the COVID patients.
Yeah.
True heroes in the healthcare world right now, because they spend every day, all day, not just in a mask, but an N95 mask, a gown, gloves, face covering, hair covering, and they stay in that all day long. And so they are the unsung heroes, in my opinion, and not just the nursing staff. It's the physicians, it's the housekeeping staff, it's dietary, it's our maintenance crews, our chaplaincy. There are many, many people that this is affecting, and we're doing our absolute best to keep them as safe as we possibly can.
Any more questions for Dr. Brennan? Actually, yeah, sorry.
Sorry.
I got one during this. Someone's asking me if we're full or worried about capacity, why local hospitals are accepting patients from elsewhere, which I feel like I know the answer to, but I'll give you a chance.
Sure. We do our absolute best to take care of the people, not only here in Great Falls, but in our region, which is a very, very large area. Occasionally, we're asked to take patients from outside of our region because their resources are at capacity. And we did see that a couple of weeks ago. We saw quite a few patients transferred from far east in the state that we would not normally get. And I think we've been able to develop a communication with all of the large hospitals so that we know what's going on. I talk to my colleagues in Billings and Butte and Missoula and Kalispell and Bozeman and Helena every morning. And so I know exactly what's going on, in their facilities. And it helps Kevin and his crew to triage patients. If we don't have a bed, we're going to find you one somewhere. So capacity is an issue. We're used to working over capacity at times. It's just when it's continuous and it doesn't stop. So.
Can I have one more? Sorry.
Sure.
Maybe the last one. Since you are operating at that level, and I know there's some internal triggers you guys have to start lowering those numbers, like elective surgeries or procedures, other things like that. Has any of that kicked in yet?
I will. That is probably the most common question I'm asked, and it's not just from the press. It's from everybody at the hospital, because they see that as a magic solution. If we stop doing elective surgeries, we'll be able to operate with all these extra patients. That's not true. I will tell you that we look at it probably every 15 minutes, every day, to see if the surgery needs to be done. There are a lot of elective surgeries that aren't truly elective. They're just scheduled. And so for me to say we're stopping all elective surgeries doesn't really apply. We have a lot of triggers, and it's based on our ICU capacity, our staffing capacity, what the emergency department is doing. So there's multiple things that play into how we manage the beds supply and situation in the hospital. Okay, thanks guys.
Does anyone have any questions for Colonel Palmer? Okay.
Can you touch again on what exactly prompts the changes between health protection condition levels? What makes you make the decision to go up or down between those levels?
So it's looking at the evidence-based factors the same way that the county public health office does it. So we look at the number of cases and are they going up or down. We look at the number of where they're coming from. We look at our contact tracing data to let us know if we're seeing what we call a cluster forming in one area. And then we adjust appropriately at that point in time. We still have several more health protection conditions we can go up to. So we increment up slowly, just like the county public health office does, but we try and stay in sync as best we can with the county as they move through their, they don't call them health protection conditions, but as they move through their bases of going up and down with what they're doing in the city, we do the same thing. We try to mirror that to the best of our abilities.
Are there any provisions in any of these levels that would impact civilians near your bases or your sites and what they could do or access to Longterm?
I would say that the impact as you move up is it limits the active duty members from doing stuff off base. As I said in my statement, we have curtailed in-house dining, so we are not allowed to go to a restaurant and sit inside because the levels of transmission are higher there at that point in time. So what we do is we try and take it incrementally, and we look at those places where we're seeing increases in cases, and then slowly, I guess you would say, remove those abilities for airmen to go into, which is why outside dining is still allowed at this point in time.
Thank you.
Any other questions? Okay, with that, we will wrap it up. Thank you for watching and thank you for coming. Have a great day.